Good afternoon, everyone. My name is Heather Dubendris. I'm one of the subject matter experts that supports the vaccination modules for the NHSN healthcare personnel safety and long-term care components. We want to thank you for taking the time to join us today for today's webinar. And thank you for all of the effort you're putting into reporting these data. We know that they serve public health importance. And we just want to start off by letting you know that we are continuing to answer as many questions as we can as quickly as possible. Um, we will continue to answer questions today through the chat and through the help desk through today. We have additional help that are working um, through the evening tonight and through Saturday and Sunday. So if you don't receive a response, please continue to monitor your email over the weekend. If you've created tickets already, those tickets will be answered in the order they were received. So we're working through those tickets that have come in the last few days. There's not a need to create another ticket. If you have the same ongoing issue, know that we'll get to you as quickly as we can. Before we dive into today's content, just a few business rules, housekeeping reminders. We ask that anyone from the media please drop for today. This is intended only for users of the annual influenza component within NHSN. Thank you very much. We also ask that our listeners today try to limit their use of the reaction emojis. A lot of folks are trying to take screenshots, and so they can capture this information, and those emojis can just make it hard for users to take that full screen capture. Thank you so much. On today's webinar, we'll walk through some of the most frequently asked questions we've been getting as far as how to make sure you activate the healthcare personnel safety component and have the right level of access, as well as how to report that influenza data. These are the most common questions we've been seeing from you all. I know that one question we have gotten at the start of every one of these office hours this week is whether or not slides are available. These specific slides are not yet available. They're working on being posted on our website through our clearance process. But this information that's contained in today's session is already available on our webpage through previous training slides that we've provided specific to long-term care facilities, including that annual training in October, as well as contained in the email blasts that we've been sending throughout the year. Most recently, this week, we've sent a few. So please refer to some of those resources as well. With that, I will hand it over to my colleague, Jolie Siegel, to walk through some of those reminders. Thank you very much. Jolie?
Thanks so much, Heather. Welcome to the Healthcare Personnel Safety Component Training Session for Long-Term Care Facilities. Today, we will review the influenza vaccination summary of the Healthcare Personnel Vaccination Module. My name is Jolie Siegel, and I work in the NHSN Vaccination Unit. The objectives of this presentation are to review some key points on how to complete annual flu reporting, go over steps on how to get started in the healthcare personnel safety component, and review commonly asked questions. Before we go further into the presentation, as a reminder, the influenza vaccination coverage among healthcare personnel measure was finalized in the final rule linked in this slide. If you have any questions, please contact CMS at the address on the slide. Beginning with the 2022-2023 influenza season, facilities will need to report annual HCP influenza vaccination summary data. These data are reported through the NHSN Healthcare Personnel Safety component in NHSN. Please note that reporting weekly flu data does not satisfy the CMS requirement. Please note that if you have not already done so, facilities must activate the Healthcare Personnel Safety component in NHSN to report annual influenza vaccination summary data. Only the NHSN facility administrator can activate a new component. If the facility administrator has left the facility before transferring their role, please complete the administrator change request form linked on this slide. When adding the HPS component, do not deactivate any other HPS NHSN components, such as the LTC facility component. Before facility administrators can activate the HPS component, they must request Level 3 access if they have not already done so. This can be done by sending an email to nhsn@cdc.gov with the subject line, SAMS Level 3 access. In the email request, that Level 1 access be removed and replaced with Level 3. Make sure to not deactivate any other NHSN components. A final key point is when to report. The reporting period for the 2022-2023 influenza season is from October 1st, 2022 through March 31st, 2023. Facilities are required to submit one report covering the entire influenza season. So in other words, weekly or monthly reporting is not required. The deadline to report the annual HCP influenza vaccination summary data through NHSN HPS component is May 15, 2023. NHSN will then transmit the data to CMS. We will also reinforce these points as we go through this presentation, as we will review the data facilities will need to collect, how to enter data, and how to run a data analysis report. The next slides provide an overview on how to get started in the HCP vaccination module of the HPS component. First, we will go over some key roles in NHSN. The NHSN facility administrator is the person enrolling the facility in NHSN. They are the only person who can activate additional components for the facility, add, edit, delete rights to facility data, users, and users access, nominate/join groups for data sharing, and is the only person who can reassign the role of the facility administrator to another user. There can only be one NHSN facility administrator per facility. Users have the ability to view, enter, and analyze data, but these rights are determined by the facility administrator. Users may also be given administrative rights. It is recommended that each facility have at least 2 NHSN users. One of these users should have NHSN facility administrative rights. This slide covers some key points on what facilities can do if there is a change in facility administrator. NHSN facility administrator should transfer their role to another user prior to leaving the facility. However, if this does not occur, NHSN can add an individual as the new NHSN facility administrator if the previous NHSN facility administrator has left the facility. In these cases, please do not re-enroll the facility in NHSN. Instead, please complete the NHSN facility administrator change request form linked on this slide. After being assigned as a new NHSN facility administrator, the individual can then begin to new NHSN user onboarding process. To tell whether you have Level 3 access, you can compare your interface to those in the screenshot above. As you can see on this slide, the Level 1 interface is gray and Level 3 interface is blue. As previously mentioned, the first step in entering annual flu data is requesting Level 3 access if it has not already been granted. Facility administrators will need to send an email to nhsn@cdc.gov with the subject line, SAMS Level 3 access. In the body of the email, facility administrators will request that Level 1 access be removed and replaced with Level 3. It usually takes between 1 and 2 days for the help desk to add Level 3 to the user's profile. Once you are approved, you will log into the application as seen in the screenshot by selecting NHSN reporting, not long-term care reporting. Please note that you only need to activate the HPS component once. To see if you and your facility has activated been activated in the HPS component, navigate to Facility, Add Edit Component, and see if the box next to Healthcare Personnel Safety is checked, as shown next to the letter A on the screenshot. If it is, then the component has already been activated. If the facility administrator has also accepted the agreement to participate and consent, as shown by the number 2 here, you are ready to report annual flu data. Once Level 3 access has been granted, users can activate the HPS component. Please note that this component only needs to be activated one time. Facility administrators will log into the LTC component and navigate to Facility, Add/Edit Component. Facility administrators will then scroll to Components Followed and check the box next to Healthcare Personnel Safety. An alert will pop up indicating you must first define the primary contact for this component. Click OK. Enter the contact information on the next page for your HPS primary contact. Note this can be an existing NHSN user. After submitting and updating this information, your FA must return to the NHSN homepage and log into the HPS component to accept the agreement to participate and consent. Once rights are accepted, your facility is ready to submit data to the HPS component, including annual influenza vaccination data. We will now go over entering data for the HCP influenza vaccination summary. This slide shows the steps facilities take to access the HCP influenza vaccination summary form after they have activated the HPS component. First, click on the vaccination summary, then Annual Vaccination Flu Summary on your navigation bar. Select Add. Next, click Continue to view the data collection form. This is what facilities will see on their screen in NHSN when adding influenza vaccination summary data. You must complete all fields marked with an asterisk on this page. Influenza and seasonal are the default choices for this screen. Once you have completed data entry, save the data by clicking the Save button at the bottom of the screen. We will now go over how to confirm data submission. First, generate datasets by navigating to the location as seen in the screenshot. We will go to Analysis on the left-hand side, Generate Datasets, and then Generate Reporting Datasets. The next step is to run a CMS report. The location of these reports are seen in the screenshot. This slide shows what the output of the reports will be. The highlighted section shows that annual flu data has been submitted for the 2022-2023 flu season. Now we will take the time to review some commonly asked questions. The first question we'd like to review is about an email that some users have received warning them that their data has not been submitted. We recommend that users check the dates referenced in the emails that they receive. If you reported data on or after the date referenced in an email, the data you reported would not be reflected in the email. We also advise that facilities verified their healthcare personnel influenza vaccination data submission by following the comprehensive instructions outlined in this document. The second question is, why is there no option to complete a monthly reporting plan? As of the 2022-2023 influenza season, the monthly reporting plan is no longer required to complete prior to entering annual healthcare personnel influenza vaccination data beginning with the 2022-2023 influenza season. The next question is, what code should I use for the FluVacLoc field when I upload CSV files? For this field, please use FluHOSP. This is the code used by most facilities. We understand this has caused confusion. Another question addresses why you might not see the HPS component even though you have already had at Level 3 access. Once you have this access, you must make sure that you are logging into the NHSN reporting, not the other options seen in the screenshot. Lastly, I will review the various resources available on our webpage. I would like to reiterate again, the NHSN Help Desk will be available this weekend on Saturday and Sunday, May 13th and 14th, 2023, to respond to open iSupport tickets. Please monitor your email over the weekend. We are working diligently to address all tickets, and if you created a ticket within the past 5 business days, please do not create another ticket, as this may create further delays. Facilities can visit the NHSN website using the link on this slide. The website contains links to the protocol, data collection forms, table of instructions, frequently asked questions, and training slides for HCP influenza vaccination summary reporting. If you have any questions about NHSN, please send an email to usersupport@nhsn@cdc.gov. You should also include HPS flu summary in the subject line of the email and specify that you are a long-term care facility. Thank you so much for your time.